So welcome back to the AGA interview. I'm more than happy to have Dr. DiFelice from New York here with me today. He just arrived from Rome, and I'm very happy that he's presenting and chairing also the international session at the next part of the AGA Kongress. But before we start, you are currently based in New York, and you are working at the Hospital of Special Surgery. So you are a dedicated knee and sports medicine guy. So what was your motivation to become a knee surgeon or sports trauma surgeon?
Well, I was an athlete my whole life. I played baseball, football, basketball. I played some rugby. I played all the way through university, and I saw more than my fair share of teammates go down with injuries. In fact, I'll never forget my junior year of university, I think it was. 8 out of 11 starters on my defensive team went down with ACL injuries. So a main focus of my life and practice is trying to solve the ACL problem, and that's kind of what motivated me all along, was the athletics.
And I also saw that you are an associate professor in New York, so you also teach and train residents. What is your motivation for training and teaching and bringing young residents to the next level?
Well, we all need to learn. You know, someone taught me how to do surgery and got me over the jitters in the beginning when it was very, very difficult. And surgery is an apprenticeship, really. You have to work with master surgeons and slowly learn the techniques, the do's and don'ts, over the years as you slowly hone your craft. And I think that I owe a debt of gratitude to those surgeons who trained me, and to pay back, I will train the next generation of surgeons, because that's how it works.
So now maybe we come to a specific part of you, the ACL, not reconstruction, but repair. So this is something which made you famous because you're doing it a little different. So, or what is your secret? What are you doing different than other ACL surgeons?
Well, I'm not so sure I would use the word famous, as a lot of people have a hard time swallowing the pill that I'm offering them. What I've done is look back at the history of kind of the evolution of surgical thought as to why we got to where we are. And currently we use an all reconstruction technique, and it takes quite a while for people to get over ACL surgery. What I did was kind of realize that the old way of doing things that led us to this technique were a bit flawed. We kind of abandoned the idea that you can repair the ACL for the wrong reasons. And so with modern technology, I've developed a way that you can actually save the ACL for certain tears, not all of them, and you can use a smaller procedure to just repair the ligament and get it to heal rather than replacing it like we do with the reconstruction. And so that makes the recovery a fraction of what it takes to recover if you have a reconstruction. Probably about half to a quarter of the time. It saves all the native tissue. The knee feels more normal because you save the nerve endings and the blood supply. And that's been the main focus of my research for the past 10 to 15 years. So I'm excited to share my experience with the Congress here today.
I think that's the final word. I think we're looking forward to your presentation at the internal session, which will take place later this day. And thank you once again for coming to our AGA Live on Air, and hopefully you'll enjoy the first time on the AGA Congress here in Vienna.
Looking forward to it. Thanks.